Okay, so Dr. Andrew McIntyre is a gastroenterologist and metabolic health practitioner with almost a decade of experience treating and reversing his patients' conditions with diet. So thanks for being on the show, Andrew.
Yeah, no, thanks for the invite.
Great. And you mentioned to me just previously that perhaps up to 90% of your work as a gastroenterologist was related to people's consumption of processed food. Can you expand a little bit on this point?
Yeah, well, I guess I've probably been doing it for 6 or 7 years. And during that process, I really started measuring, waist height ratio routinely and looking at lipids routinely. So it's really a question of how many people have significant disturbance in those parameters. And, I think it's a very high percentage of my patients, that actually have those parameters significantly out of whack. So, and, you just a simple thing as looking at people's triglycerides is an important aspect of it. So, and I also have a software company, Medical Objects. So we've got a lot of decision support stuff that automatically calculates things like triglyceride HDL ratio and things like that. So that allows me to look at those parameters automatically from lipid profiles. And we also, every patient we get, we tend to request their recent results. So, and often people have lipid profiles, even if they're coming in for just an open access endoscopy, or colonoscopy. So those parameters are often available. And based on waist height ratio and lipids, the incidence of significant metabolic disturbance amongst the patients is high. Now, I guess you have to compare it with the incidence in the general population. But my experience is that if you can correct those parameters, people tend to get better. And, you end up with the feeling that you've been practicing Band-Aid medicine for a long time and, not really looking at root cause. So it's probably made me a lot more interested in medicine, really, because you can actually fix some problems at the sort of primary cause rather than what has been like Band-Aid medicine really for a long time. So, I also I used to, before I was mandated out, do a lot of ERCP. So looking at patients with pancreatic cancer, almost to a T, they have evidence of metabolic dysfunction and insulin resistance. So I've also been doing a lot of, fasting insulin glucose to calculate HOMA IR scores and things like that. So basically I have for people I'm seeing again, I tend to do their metabolic parameters and follow them over time. So, and I mean, like any intervention, not everyone is interested, but the people who are generally respond very well. And fatty liver shows spectacular response to low carb diets, and we've got good evidence for that. So it's still not really a mainstream activity, unfortunately, but it's gradually catching on, I think.
Yeah, great. And what Dr. McIntyre is referring to specifically are biochemical markers. So when you go and get a blood test, the doctors will look at the different parameters of your blood markers, your liver function, your lipid profile, your fasting insulin level, and a range of other markers that basically give us an idea about your metabolic health. So, Dr. McIntyre, can you explain this concept to a layman, someone who might not understand what metabolic health is or what it means? How would you describe that concept?
Well, it's really how you process nutrients, I think, the efficiency, and particularly how you process glucose. And in many cases, it's disturbed. And what you see often is people lacking in energy, but excessive nutrients. So they're overweight. But I used to doubt people that said I don't eat much, but I now realise that their metabolism is so impaired that their energy, they're not burning as much energy as they should, and they feel tired. And I guess, probably our innate mechanisms of feeling tired are fairly sophisticated. So if someone's tired, they have a lack of energy supply, and that is really a sign of poor metabolic health. And it seems to be, insulin resistance is a part of that, in that they're not actually metabolizing glucose, getting it into cells and burning it for energy. So they are listless and tired, basically. So that's really what metabolic health is. And in the modern setting, it's insulin resistance. And, that is certainly something that appears to be new, in that I think the last time I checked, diabetes has gone up 800% since 1960, thereabouts, type 2 diabetes. So something has caused a change, and it's unlikely to be genetic in that period of time. So there are really, the big changes are the introduction of dietary guidelines, a marked increase in refined carbohydrates, but also a marked increase in the consumption of vegetable oil over saturated fat. And, I do think the latter may well be a significant component of it as more of a root cause, because, some cultures don't eat a lot of sugar as such, but they still have the same metabolic health problems. So, China, for instance, has a higher incidence of type 2 diabetes than the US, but their obesity is much less, and they don't eat the same amounts of sugar, but they're certainly consuming vegetable oil compared to what they used to, and the same in India. There's what they call vegetable ghee rather than, butter-based ghee. So, and they have a high incidence of ischemic heart disease. And my view is that obesity is just an adaptive mechanism to metabolic dysfunction. It's like shove this glucose into fat somewhere, and it actually doesn't cause terrible problems until you reach a point where you can't put any more in there. And like the Chinese don't appear to be able to become as obese as Westerners. So there is a discord between obesity and metabolic dysfunction. Some of that's probably genetic, and it probably reflects, heritage of high carb sort of diets, perhaps. I don't know. Europeans seem to be able to get fatter, and it probably protects them until they reach a point where, they can't get any fatter than they are, in which case it spills over into the blood and you end up with diabetes.
Yeah. Yeah, and I guess most people have heard of diabetes, and they understand that as a kind of a discrete disease. But what I don't think that most people realize is that we've got a spectrum of metabolic dysfunction, and a frank diagnosis of type 2 diabetes is basically at the late stage of that process.
Oh, yeah. So I mean, teenagers, I've seen lots of teenagers and things like PCOS, polycystic ovarian disease, irritable bowel reflux in young people. They often have insulin resistance, and they're often not overweight. And I mean, it's interesting that people with, you can get a fat disorder, I can't think of the name of it at the moment, where you can't lay down much subcutaneous fat. And those people have the worst metabolic disorder because they don't have a buffer. And really, body fat is a buffer for, excess glucose in your blood gets turned into body fat. once you fill that up, then it ends up in your liver and you end up with visceral fat, which is a marker of metabolic dysfunction. So, which is
Yeah.
why waist-height ratio is so useful.
Hmm.
So,
And that was going to be my next question, which is, a young person can come in with these health conditions that are related to insulin resistance and metabolic dysfunction, but they might not recognize or realize that they're on this pathway to quite a severe condition. But
no, that's right.
something like a
Mm.
waist circumference or a waist height ratio, which is basically a division of both of the height over the waist circumference, is a really early and good indicator and proxy for metabolic dysfunction. Would you agree?
Oh, definitely. It almost gets to the point where that's a good enough test. Like, in a low tech way, I've been doing, a lot of insulins and things like that to sort of confirm my impression. But in the end, waist height ratio is probably a pretty good proxy for it all. And it's almost enough. I guess over time, I've gradually almost moved away from worrying about all the other tests and using that as a primary marker. And it's a very cheap, low-tech marker, but it's very useful. And you have lots of people with a normal BMI, but a disturbed waist-height ratio, like particularly Asians. So they don't tend to get obese, and they can have a normal weight, but their waist-height ratio is still disturbed. And I've certainly seen those people come good moving away from using canola oil, for instance, to using saturated fat for cooking. That change on its own seems to make a big difference. So I do think that the omega-6 oils are an important part of it. I mean, we don't have all the large trials that we should have because there is no pharmacological value in this. In fact, it's the opposite. You tend to take people off drugs. So following this path is not very good for drug sales, that's for sure. But there's lots of small studies that show amazing effects. And
Mm.
I think we need to move away from this idea that a large multi-center randomized controlled trial is the only way of deciding anything in medicine, because I think it biases us to vested interests, because those big studies cost many millions of dollars. So you need someone who's going to benefit to pay for them. And the government doesn't seem to be capable of running anything like that. So we need to accept that smaller studies, a bit of clinical observation, um, can give you pretty good answers. There was it was published in Cell Biology, I think, a study of 10 people with fatty liver who were put on a keto level diet, 20 grams of carbohydrate a day, and they were fed macadamias to try and avoid weight loss. And over 2 weeks, they lost 50% of liver fat, all 10 of them. So, the odds of all 10 people losing this enormous amount of liver fat, and that's not the only thing that happened. Their microbiome improved, all sorts of other things improved. The odds of that being by chance are virtually nil, but people would go, 10 patients, it's not relevant. But it's highly relevant because they studied everything very closely. And, to me, that study is very good evidence that it works. And clinically, people's chronic abnormal liver tests will come back to normal within a month often. So and it's basically losing liver fat that improves things. But even then, the improvement certainly precedes weight loss, because I think your peripheral fat is pretty benign in general. It doesn't cause trouble, but your visceral fat does cause trouble, and it may only be a kilo of fat, but you tend to get rid of that first. So the improvement of burning a kilo of visceral fat is enormous. Even if people don't lose weight, I mean, they can gain weight and still get better. So the evidence is certainly there, and certainly, there's multiple trials, even on weight loss, that show
Yeah.
a superiority of low-carb diets.
Yeah.
And it's through change of metabolism.
And I guess the interesting thing is that we're really proposing an entirely new model of disease related to your waist circumference, which is a proxy for your visceral fat. And we're dispensing with this idea that obesity per se is the, I guess, the root of the problem. And
Yeah.
I think for so long, so many people have been led to believe that it's the obesity itself rather than where that obesity and where that fat is being stored. And as you've mentioned, you can have people with a normal BMI who have a large amount of very, very metabolically dangerous visceral tissue. And you can conversely have quite an overweight person with normal metabolic health parameters. So I think as doctors, what we're trying to do is push this idea that it's not your total BMI. BMI can be helpful as a secondary or a taken in context type of marker, but it's the fat around the organs, which is best proxied by your waist circumference, that is the most dangerous type of fat. And as you have mentioned, is a risk factor for or occurs in people who have IBS, irritable bowel syndrome, reflux, and who are having these biliary and gastrointestinal cancers at a dangerously young age.
Yeah, and I think the young age is obviously a concern, and we've certainly seen an increase in young people with bowel cancer and pancreatic cancer too. And the studies from the past of colonization suggest 2 decades of Western food is enough to induce Western diseases. So if you're 20 and you've been eating processed food all your life, which many people have, you're at risk of problems in your 20s. And we've certainly seen more type 2 diabetes, bowel cancers at an increasingly younger age. And when you look at what's in children's lunchboxes and what their school tuck shop is selling, it's probably not a surprise if it, and I think it is processed food, which is very rich in sugar and vegetable oil. Then if that's the low fat way, so to speak, and the pernicious influence of guidelines is that things like tuck shops are following them. So we're feeding our children high omega-6, high sugar foods to reduce fat. And I know particularly in the US, it's like you can't have whole milk, but low-fat chocolate milk is an acceptable thing for a school child, and it's quite ridiculous. I mean, there's solid evidence that children having full-fat milk are less obese than children having low-fat milk. And the other myths of eggs, I mean, even totally mainstream nutrition now doesn't condemn eggs. They are certainly a health food, but I run into it all the time of particularly elderly patients who are trying to do the right thing, avoiding eggs, and there really are a very good, I think there's 6 grams of protein in an egg. So, particularly, I see it in sort of widowed older women living alone, and they're having toast and jam, and I don't eat much meat, and you eat many eggs, I know more than 2 a week. And it's like, well, you should have eggs for breakfast every day, and they're horrified at that thought because eggs are dangerous. So the mainstream nutrition, while it may have shown that eggs are not a concern, they've not made any noise about it. So much of the population still thinking that eggs are bad. And a lot of those people would do much better, and it's a simple, relatively cheap, easy to do on your own sort of source of food. So, I try and push eggs onto those people.
Yeah. Yeah.
But you still meet resistance because these myths are persistent,
Yeah.
and the authorities have not really tried to undo the myths that they created.
Yeah.
So it is a concern, and I mean,
Yeah. And Andrew, I know I've seen the same thing in my practice. I've seen patients who are earnestly trying to do the best thing by their health based upon what they've been told. And they do have fatty liver. They do have markers of
yeah,
metabolic syndrome and metabolic dysfunction. And they're being let down. And I think that's not right. And I think that it isn't fair that someone who is trying to do the right thing is having such an outcome that's leading to disease based upon what they've been told. And as you mentioned, the kind of narratives around the harm of animal foods like eggs, like saturated fat, like red meat, these narratives are unraveling. And the shaky foundation of science, which is usually nutritional epidemiology, upon which these narratives were built, is crumbling. As the tide comes in, the foundation's washing away. Yet the mainstream narrative is not following up with messaging that supports or is in concert with this kind of scientific realization. So you have a situation where people are still avoiding eggs, they are still avoiding full fat dairy, they are still avoiding red meat, and they're thinking they're doing the right thing. I mean, it's very, very, very unfortunate.
oh yeah, and it's an alarm if somebody says to like I've made it a practice of talking to every patient about their diet, and the biggest alarm signal is, "But I eat a good diet." People who say that, 95% of them are following outdated guidelines, and it's a red flag if somebody says that. And they are trying to do the right thing. That's the silly part about it, is that often the people who are trying the hardest to do the right thing are the worst off, because they're following advice which is bad, and they're following it religiously. So it's the fear of saturated fat is so ridiculous. The evidence was very circumstantial, and it's been disproven. So and I think there's evidence, things like macular degeneration, that omega-6 in your retina, which oxidizes on exposure to light, could well be we've had an explosion in macular degeneration, and the oils you eat get into your cells and into the membranes of the cells and the mitochondria, and in your eyes they're exposed to light. So they damage your retina and cause macular degeneration. And there's also evidence on things like melanoma, which are not sun-related, that it could be vegetable oil that actually is a big factor in the increase in that. So there's lots of well-established facts, in inverted commas, which appear to be wrong and are actually damaging to people's health. So, and that probably brings in the vested interest, and the vested interests are not only pharma, but it's also food companies. So high shelf life, very profitable products often produce in response to requests for low fat food, but they've become a multi-trillion dollar industry. So if you say, I mean, often it's a cliche, but I think it's a good cliche, is, shop around the edge of your supermarket. Don't go into the center aisles, other than to buy some olive oil or something like that if you want to. But it's it's not profitable to large food companies, basically, because you're buying meat, eggs, dairy. It's usually in the fridge. And for many supermarkets, the design is it's around the edges. So that's sort of a fairly good rule, in terms of shopping. So, but we're facing an uphill battle because really we're asking people to support local farmers and, rather than multinational companies, and all that food goes off. So it's sort of harder to make big money out of it, but the vested interests are a problem, I think. So it's an uphill battle to
Yeah.
try and convince people.
Yeah, and that's interesting because you've mentioned this uphill battle on a couple of different fronts. From a medical point of view, and as us as doctors, for decades, the standard of treatment was based on this concept called a randomized controlled trial. And basically anything that we do, any drug we prescribe, has to be or essentially backed up by evidence that's generated in this type of trial design. That works, especially for drugs, and especially in situations where you can control the intervention and make sure that there's no other confounding factors. But the problem with that approach, especially as it comes to diet, is that it's very difficult to randomize someone to a specific diet. And therefore, the evidence base that nutrition is founded upon is all observational and long-term observational data, which is based on a very flimsy type of study called the food questionnaire. Again, subject to bias, like a recall bias, where people will record what they think the investigator will wants them to say. So you've got the problem with the science that backs up nutrition. Then you've got the vested interests that perhaps are influencing what type of studies get funded and what type of studies get published. And then you have the food industry as well. So, I mean, as you outline, Andrew, there's lots of headwinds that are, I guess, pushing against the individual when they're trying to make a healthy life choice.
Yeah, and there's headwinds convincing people to try it. There are certainly large groups of patients who really are resistant because it's dangerous. And, I think in the end we're saying Atkins was right, and he was certainly vilified, but most of what he said has really now been proven.
Yeah.
And his sort of scheme of following the diet, I think, is probably still almost the best scheme, where you start low and then you can add in a little bit more carbs to a point where it stops working.
Okay.
So you often see people like, even some dietitians who are not opposed to low carb, but they'll start at 100 grams a day or something. And for many people, that's too much. So it won't work. Whereas, if you start very low, you'll suffer for a week or 10 days, but you'll see results. And then you can actually slowly creep your carbs up if you want to. And you'll see the effect stop working, and you know what your tolerance is.
Yeah.
So, and a lot of the published so-called low carb is like 40% of the diet. The guidelines are like 50-55% carbohydrate, and they'll call low carb, 40%. So it's not enough to make a difference to many people. So, but I had one diabetic educator walk out of my consulting room when I suggested she try a low carb diet, and she had fatty liver and all the normal accompaniments of metabolic syndrome. But she's been so conditioned of low fat diets that the mere suggestion of a low carb diet was so abhorrent to her that she got up and walked out in the middle of a consultation. So there's no chance to explain it or show her any evidence, it's almost religious in some circles. So
yeah. And I guess for the listener, what we're proposing or what we are suggesting, based on clinical experience, is that the best dietary approach for someone who has metabolic syndrome, signs of insulin resistance or metabolic dysfunction, is a low carbohydrate whole foods diet that replaces these toxic omega-6 oils, fatty acids, with saturated animal fat. And I guess that's what we're talking about here in the dietary approach. So Andrew, say you have a patient come in, she's 25, she's got a raised waist circumference, she's got polycystic ovary syndrome, and she's an open-minded to trying anything that might help her. What is the rough type of advice that you would give a patient like that in your clinic?
Well, I just explained to them that I think it's, excessive carbohydrate and sugar in the diet that's causing the problems, and they're probably genetically predisposed. And often they're not that fat, but I'll usually point out the waist circumference, giving it, and I will give them things like ditchthecarbs.com handouts. They are very good, and suggest they go and do some reading. We use David Unwin's Teaspoons of Sugar cards. We've had some of them printed up, and it's things like, bananas and things like that. So, there's a recent study showing, people who are eating the recommended 4 serves of fruit a day are doing worse on the fatty liver front than the people that aren't. So, there's a lot of myths. Plus, there's a change in food. Our fruit has become much higher in sugar than it used to be. So, and what do they call it? The bliss point. There's no doubt that these foods are, they're addictive. They are yummy, and they give people a short-term high when they eat them, and short-term energy. But it's doing a lot of damage, and it's really all the Western diseases. And, there's a significant effect on fertility as well. Plus, diabetes of pregnancy, all of those things are tied up. And I always think that if a low-carb diet does wonders for fertility, that's nature voting. And, if nature thinks your diet is bad, then your fertility declines. If nature thinks you've got all the nutrients you need, then nature votes with you on that. So it's, there's very little evidence there's virtually no evidence of harm with them. And even lipid profiles usually improve. And, if people are compliant, sometimes their LDL will go up. But if you do their LDL subfractions, they are generally a non-concerning rise in LDL. It's a sort of energy transporter, and it's the small, dense, oxidized LDL that is the problem. I do sometimes run, it's not uncommon to run into problems where people take the advice up to a point, but they go, I still want to eat bread and I still want to eat my fruit. So, somewhere in the middle is not a good place to be. So if you're going low carb, you need to go low carb, not, slight reduction in carbs and an increase in fat. You need to reduce your carbs enough to get your insulin down, and then you will metabolize the fat. If you don't reduce your carbs enough and you're eating lots of fat, then you'll just put on weight, basically. So there is a point of compliance that you need for it to work, and there are certainly people who don't go far enough, and they can be worse off if they follow the bits they like, but not the other bits. So that's important to follow people up and just see where they're heading. And there are a percentage of people, if they can't give up those things, they may be better reducing fat in that case, but I don't think it's as ideal. It's sort of like the vegetarian diets are probably better than a processed food diet. I don't think they're optimal, and you're missing out on lots of nutrients. But there's no doubt that if you're eating a lot of processed foods and you go whole food vegetarian, it's better than a processed food diet. So you can go either way. I certainly think going towards the more animal foods is a better option, particularly nutrient-wise. But you don't want to be sitting in the middle. It's the middle where the danger lies, I think. So,
Yeah.
so
And I was going to ask you about,
yeah.
yeah, I was just going to ask you in terms of your clinical practice and what you've seen of gastrointestinal conditions. Do you see vegetarian or vegans overrepresented in any of these diseases? Because especially around young people, there is a very strong societal push towards vegetarian
Oh, yeah.
and vegan eating.
Certainly causes
What are your
irritable
thoughts on that?
bowel. Certainly causes irritable bowel. And if it's not a whole food vegetarian diet, then it's often worse. And you see this with like people who think they might be gluten intolerant. Now, in the past, that probably worked because they went on a low carb diet without knowing it. But now you can go to the supermarket and buy all sorts of processed junk that's gluten free. So they end up worse off because they end up with lots of sugar and rice flour and things that are gluten free, but they were never available before. Celiacs were basically eating meat, eggs, and vegetables in the past. Somebody came up with gluten-free bread, which wasn't that nice, so they didn't eat a lot of it. So they often did very well. Whereas now it's easy to eat a very high processed food diet and be gluten-free, for instance. It's the same with vegetarian. They'll advertise a product which is junk as being vegetarian. So, even my daughter said to me, I don't really like coming here because you don't have any food. And I'm going, what do you mean? And real food. And her answer was something I can open and eat. So that's her that was her real food definition, is a packet that you can rip open and eat. So and that's sort of become the norm, and I think it's like party food every day.
Yeah.
Party food has always existed, but I don't think in the past people had, chips and lollies and all of these things every day. It was actually for a birthday or a special occasion. Whereas, like you walk into a garage now to buy petrol and they're actually saying you can get 2 candy bars for $2. They're pushing them on you, and the whole counter is just covered in sugar, basically.
Yeah.
So it's everywhere.
Yeah.
In a modern society, whereas, I don't know, but I suspect that petrol stations in the past sold oil and things like that. They didn't
Engine
sell.
oil. Yeah.
Yeah, they didn't sell sugar.
Yeah.
So it's everywhere, and it's normalized. Snacking is normalized. Whereas
I was just going to say quickly, I agree that, and I feel that the narrative surrounding the vegetarian dietary approach is a continuation of this misleading food narrative, where people think they're doing the right thing by their health by going vegetarian. Inevitably, they get a craving for nutrient density and energy density, and end up reaching for the vegetable oil laden chips, the fries, or the ice cream, because they're not having their nutritional needs being met by a bland plant and grain based diet. So it is very unfortunate, and I would encourage any listener who is perhaps suffering from irritable bowel syndrome, reflux, polycystic ovarian syndrome, take a pause, think about your dietary choices, think about why you've adopted perhaps a vegetarian diet. Where has that belief come from? Examine that belief, and then consider adding back in some of these animal products. Consider getting rid of the vegetable oils and all that fast food, and the door delivery food is all cooked in vegetable and seed oils, and see what happens to your health. Because I mean, as you say, Andrew, your experience of patients with irritable bowel syndrome on a low carb whole foods diet is incredibly successful.
It's what I would reach for first. As I said, in 80 or 90% of my patients, I'm not saying 80, 90% of the patients take it up, but it would have seemed like the most appropriate treatment. And I joked that I'd just close the rooms and put the low carb leaflets on the door, and
job done.
Job done.
Yeah.
Exactly.
Yeah.
So, and for most people, majority of people, that would probably be true, really. So, but fighting a well-embedded narrative it's not going to happen overnight.
No.
So, but I mean, I think people need to have less faith in authorities in reality, because I don't think the authorities are competent, and I can only assume that there's some conflict of interest in there, because there's ample evidence of people doing well on low-carb diets, but we still see all this anti-meat narrative, which is nonsense as far as I can see. And so, you have to really do a little bit of your own research to actually get to the truth of the matter. And it's certainly a safe alternative. So if you're not doing well, it's worth trying.
Yeah.
And often the improvement is like within weeks,
Yeah. I'm then thinking, if we're thinking about first principles, what we've described so far is a diet that basically allows you to get your insulin level low and switch your metabolic mode out of a purely glucose and sugar burning mode to a more fat-based burning metabolic state. But and also a diet that provides enough nutrients. So we're seeing more and more people try an exclusively meat-based diet, like carnivore diet or an animal-based diet. What's your experience of this approach in your gastroenterology practice?
Well, I can't say I've got a lot of experience, because I haven't really had very many patients either on it or even willing to try it. I have suggested in one or two patients with troublesome Crohn's disease that they could try it, because there's a lot of anecdotal evidence that it can work for those people. I mean, they probably do need to eat, a bit of offal and not just straight steak to get all the nutrients they need. But, you mix it up with some decent quality eggs and things like that, and you're going to cover yourself nutritionally quite well. So it certainly has anecdotal evidence of working. I haven't really been pushing it, other than in a couple of patients with really troublesome Crohn's disease. I certainly push low carb for people with inflammatory bowel disease, and I can't say that I've had people where it's gone on that, but the level of control has vastly improved, is my experience. And it often avoids you going to the next step with a drug. And often that's where they're motivated, is they're not controlled, and you say, well, we probably need to add in something else, either an immunosuppressant or a biological or something like that, or they're a bit steroid dependent. and you really want to get them off it. So it can make the difference in that respect, and you don't need to go to that, or you can get rid of or vastly reduce the steroid. I've certainly had people in that line who improved, and one of them, it's anecdotal, went vegetarian because on his own bat, because he thought, well, all this animal food is unhealthy, so I'll try vegetarian. And after 6 months, he's back, and I'm going, how's the vegetarian diet going? It's like, oh, I've gone back to low carb because, within a few months, things were flaring up again. And I think, again, if someone's eating a lot of junk food, going whole food vegetarian is probably an improvement. But I think going the other direction to a whole food, more animal-based diet is actually a better move. So So that's the experience is that it vastly improves control of inflammatory bowel disease. Anecdotally, some people, particularly with Crohn's disease, have shown remission. So if people are in trouble, it's something that can be considered. We don't have the level of evidence that you'd like, but it's certainly worth considering, I think, at this point in time.
Yeah, especially if the alternative is having parts of your bowel resected surgically, or being put on lifelong doses of heavy immunosuppressing drugs. It seems like definitely something worth trying. And we're coming up almost on a finish time, Andrew. That's been a fascinating insight you've given us. Do you have any closing thoughts about diet or metabolic syndrome, and I guess what the best way moving forward is for the majority of people?
Well, I think it's looking at information sources, and I certainly use the ditchthecarbs.com handout, which is a New Zealand pharmacist that runs it. Dietdoctor.com has lots of information, and Low Carb Down Under has had conferences. I did a lecture on that a few years ago, but there's lots of good lectures there. So really educating yourself is important. And, you can replace, some people are very into food. I'm sort of happy with simple food, but, there are lots of recipes and ways to replace what you're used to with low carb alternatives without vegetable oil. So there's a big learning process, but I think understanding what you're doing is important part of it. So that's looking at those information sources, watching some lectures, try and get an understanding of it, because once you understand what you're trying to achieve, it's much easier to be compliant, I think. So, and, in those places you'll find alternatives to the processed food things that you miss. It's always more work. Cooking becomes more work in general, but I think we've not paid enough attention to our diet, and our health has suffered as a consequence.
Yeah, I mean, great closing thoughts. And I'll have to get you on for another repeat episode, because we haven't even talked about your adventures in regenerative farming and your agricultural endeavors. So thanks.
Well, it led me there. So it's quite focused on that at the moment. So I'm not sure if I'm a font of knowledge, but I'm interested. So
great, fantastic. All right, thank you very much, Dr. Andrew McIntyre, and we'll speak again soon.
Okay, great. Thank you.